Be careful making medical assumptions about people whose full story you do not know. One of the biggest problems in medicine today is not lack of information, it's overconfidence with incomplete information. People see one piece of someone's story and think they understand the whole picture. They see someone overweight and assume laziness. They see someone using a GLP-1 and assume weakness. They see someone using peptides and assume shortcuts. They see someone struggling with pain, fatigue, inflammation, or metabolic disease and assume they just need discipline. But here's the truth. You do not know the whole patient. You do not know their childhood, their stress, their sleep, their trauma, their medications, their labs, their hormones, their inflammatory history, their injuries, their military service, their shift work, their food access, their financial stress, their failed attempts, their genetics, their pain, their loss, their recovery capacity, their pattern. And if you don't know the pattern, you don't understand or know the decision. This is something life teaches you. If you actually lived inside of hard systems, everyone can talk about war when they watch it on the news, but very few know what it feels like to stand there, carry the weight, feel the pressure, and live inside the consequences. Everyone can talk about law enforcement when society tells them what opinion to have, but very few put on the vest, walk into the call, make the decision, and live with the outcome. And now everyone could talk about medicine because the internet gave them vocabulary. AI gave them summaries. Social media gave them confidence. But vocabulary is not wisdom. Information is not immersion. And confidence is not clinical judgment. Medicine requires depth. It requires humility. It requires pattern recognition. It requires understanding the person in front of you. This is why one protocol cannot exist for every patient. The same symptom can come from completely different biology. The same peptide can be intelligent in one patient and inappropriate in another. The same medication can be a crutch in one context and life-changing bridge in another. The same body weight can represent years of poor choices in one person, hormonal disruption in another, trauma in another, medication effects in another, sleep apnea in another, insulin resistance in another, and a combination of all of it in somebody else. So when people say, just eat better, just exercise, just stop being lazy, just do it naturally, peptides are cheating. They are taking the easy way out. That's not wisdom. That's bias speaking with a microphone. And bias becomes dangerous when it pretends to be medicine. Peptide medicine should not be about shortcuts. It should be about matching the right signal to the right pattern. Sometimes that pattern is metabolic, sometimes inflammatory, sometimes hormonal, sometimes immune, sometimes neurologic, stress-related, injury-related, foundational. Sometimes it needs a clinician before you need a peptide. That is a Praxis approach, not judging the patient from the outside, understanding the system from the inside. Because the goal is not to hand every person the same protocol. The goal is to ask better questions. What is the pattern? What is the signal? What is the risk? What is the context? What has been tried? What is being missed? What should be monitored? What decision actually makes sense for this person? That's the real personalized medicine. And this is why I push back against the stigma around peptides. Not because everybody needs them, not because they're magic, not because foundations do not matter, but because calling every peptide as lazy, weak, or shortcut driven ignores the reality of human biology. Some people aren't trying to avoid the work. They're trying to make the work finally produce a result. Some people are not looking for an escape. They're looking for a signal their body has stopped responding to. Some people are not undisciplined. They are dysregulated. And until you know the whole person, Be careful pretending you know the whole answer. That is what Praxis Peptide Institute teaches. Peptide medicine needs systems, not bias, not stigma, not one-size-fits-all protocols. Systems, signals, context, and humility. Because the moment you think every patient fits into one box, you have stopped practicing medicine and started defending your own assumptions.
Do ba do ba do ba do ba do ba do ba do.